Robyn Flynn filling in for Elias Makos all this week. Last week, Santa Cabrini Hospital was in the news after Quebec's language watchdog decided to pay them a visit, make sure that the doctors and nurses were speaking French in the OR and speaking French to patients. Yeah, sure, doing that during the summer when hospitals are notoriously short-staffed seems like a great idea. Not. Robert Libman, who's an architect and building planning consultant, former Equality Party MNA and Gazette political columnist, had a great piece on this a couple days ago in the Montreal Gazette, and he joins us now. Good morning, Mr. Libman. How are you?
Good morning, Robyn. Nice to hear your voice again back on CJD.
Oh, thank you. It's great to be back. I read your article and I really wanted to chat with you about it. What was your initial reaction when you saw this story? I imagine very similar to CJD listeners who were outraged.
Well, it was infuriating. During the summer, at least, we should get a bit of a break from language politics. But no, sure enough, it rears its ugly head again. And what bothers me most about this is that, and you touched on it a moment ago, our overworked healthcare professionals are preoccupied with caring for sick patients, with saving lives. They don't need this nuisance, this distraction of language inspectors or advisors, as the OQLF calls them, buzzing around while they're at work, while they're trying to work. And not to mention that anything that imposes a constraint on their direct care for the health or the safety of their patients, such as these bureaucratic rules that can complicate essential communication, anything that compromises or slows their care for their patients goes against their training and their very ethos and even the Hippocratic oath that healthcare professionals, that doctors take. This is uncalled for, and I think we have to hear something from the minister to have the OQLF back off, because healthcare systems should be a language politics-free zone.
Absolutely. And this is something that the CAQ has been promising us with changes to language laws, saying, no, don't worry, Anglophones. Your rights to receive healthcare services in English are still protected. But I mean, I had to go to the SHIM when I was pregnant a couple of years ago, and there was not a single doctor or nurse who was able to speak to me in a language other than French. So, where's the watchdog follow-up for that? Apparently, I have a right to be served in English, and I wasn't able to receive care in English.
Well, you're a taxpayer, are you not? Should you not be entitled? The government certainly doesn't refuse your tax dollars. You are a human being that exists, that requires health care, and as a Quebecer, you should be entitled to the best quality health care available to you. And healthcare professionals certainly are willing to do that, regardless of where you go. You can go to a hospital, and a professional will be obligated to treat you in the most compassionate way possible. They shouldn't have to flip through some type of list of regulations and determine whether or not they're allowed to dispense services to you in the most appropriate way possible. And this is what's very infuriating. They are trained to provide health care, not to consult a manual regarding language rules. And this is one thing that Eric Girard, the minister responsible for relations with Anglophones, and François Legault insisted, as he said over and over again during the passage of Bill 96, that healthcare wouldn't be compromised. Christian Dubé, the Minister of Health, during the reform of the healthcare system, and Bill 15, which created Santé Québec, also over and over again, he repeated that the healthcare access to Anglophones in their language would not be compromised. And where are they over the last few days? Why this silence from them? Christian Dubé usually jumps in very actively when something comes up in one of the hospitals, and he's very visible and present in response to the issues, but we haven't heard a peep from him over the past week on this very disturbing issue.
In addition, this week, there's been other stories that have been coming out. Aaron Durfell's been doing great work, as usual, at the Montreal Gazette. We have more and more doctors in Quebec opting out of the public system in favor of the private system. Wait times to see medical specialists are up over a year. The average is 400 days now. And we are going into operating rooms to make sure that the doctors and nurses are asking for instruments in French. I mean, make it make sense.
Well, that's part of the major issue too. There's such an abundance of issues that we're dealing with on a regular basis in our healthcare system. The government has a mountain of priorities to attack that they should be focused on. Going into operating rooms to make sure the professionals can provide service in French, it's ridiculous. It's irrelevant, because every operating room in any major hospital institution in Quebec provides service fully in French, whether it's the Jewish General Hospital, whether it's Santa Cabrini, whether it's the McGill University Health Center. These institutions operate fully in French. without any compromise to healthcare. And that's why I find that this initiative, this latest infatuation by the OQLF with our hospitals is so irrelevant. And compared to the major issues that we face, it boggles the mind why they're doing this and why the government hasn't stepped in, or why some of the ministers haven't stepped in to say enough is enough already.
Yeah, you argued in your piece, Robert, that these OQLF hospital visits are akin to an attack on healthcare workers. I imagine whether or not you're an Anglophone and Francophone, no matter what language you speak as a doctor or nurse, you're just trying to take care of your patients in a very, very stressful environment under very difficult conditions. Absolutely, I could see how that would be perceived as an attack on these workers.
Well, all you have to do is read the Hippocratic Oath, which is still regarded as the cornerstone of the medical profession. All doctors have to take the oath, and it says that I shall work with I'm reading it here, actually. I shall work with my profession to improve the quality of medical care and improve public health. And then it goes on to say, and I shall not let any lesser public or professional consideration interfere with my primary commitment to provide the best and most appropriate care available. That says it all, that there should not be other considerations other than the health of the patient that comes into play when a professional is dealing with a patient. And whether it's language, whether it's any other factor, that their primary consideration has to be the health and safety of the patient and not some bureaucratic diktats from an Anglophobic bureaucrat in this government.
I'm curious, is the OQLF bored? Are there not any signs they can go measure? We need a pasta gate to distract them.
I think so. I'm surprised this hasn't yet generated some media attention around the world or in the rest of Canada. We certainly, the silence has been deafening from even the federal government, or even Jagmeet Singh, who was in Montreal yesterday, hasn't said a word about any of this, which is disturbing. And at least a shout out to Mario Napolitano and his Bridging Ethic Communities group that had a demonstration outside the hospital, and they're trying to bring attention to this matter. And I'd like to see at least a politician, even a Liberal opposition member of the National Assembly, come out specifically to attack this latest initiative by the OQLF, because this goes beyond anything that is of human dignity and common sense.
Absolutely agree with you. Robert Libman, architect and building planning consultant, former Equality Party MNA, Gazette political columnist. You can check out his column on Montreal Gazette's website. Thank you so much for your time today. Really appreciate it.
A pleasure, Robyn. All the best.
Likewise. Is there a better time to do this? I mean, that's the thing. I feel like there is no good time for the OQLF to be popping into our healthcare institutions to make sure that language laws are being respected. Just because it's summer and everyone's on vacation, okay, but then come back during flu season when there's overcrowding in the ERs and there are no beds available. It really is no good time. And especially with the current state of Quebec's healthcare network, I mentioned that we are hemorrhaging doctors from the public to the private sector. Wait times have exponentially increased since the start of the pandemic. I feel like our healthcare network is so fragile that we risk doing permanent damage at this point.